Welcome back. South Africa recorded 3,105 new COVID-19 cases in the 24 hours to Friday evening, adding to worries about infection trends ahead of the December holidays. The Eastern Cape has been highlighted as an area of concern. So what needs to happen then to avoid a return to a stricter lockdown and more coronavirus-related deaths? We can now speak to Professor Helen Rees. She's with Wits University, also a member of the COVID-19 Ministerial Advisory Committee and the World Health Organization's Emergency Committee on COVID. Professor Rees, always good to speak to you. So just how loudly should the alarm bells be going off after more than 3,000 new cases were confirmed in this latest daily update from government?
Well, they have to go off very loudly for three reasons. One is that we've now seen a real jump in cases. For a couple of months, we were managing to keep the numbers below 2,000, and suddenly we've gone up to 3,000. The second reason is that we know why this has happened. It's because we've had super spreading events, and that people in the Eastern Cape and in areas along the Garden Route in particular have been to sports events and nightclubs, and those super spreading events have sparked these increases in numbers. The third reason that we should be really alarmed is that we're very worried that this is going to be behavior we're going to see over the holiday period. This is exactly what happened in Europe, and now they're seeing a huge surge in cases.
Should we not then reimpose or bring back one of the stricter lockdowns to avoid that spike? Because that's exactly what happened in Europe. I recall in the UK, where in Liverpool, the super spreader events where young people were partying, for example, were the key drivers in the skyrocketing, essentially, of infections there.
Well, in fact, we still have a state of disaster, and we still do have requirements about the numbers of people you can have in closed areas and in open areas. We have requirements to wear masks in public places, and we're strongly recommending sanitizers. So all of those requirements are written into regulations at the moment. They're written into the recommendations under the state of disaster. The problem is people aren't using them. So I think what we really need to do is to work out how we encourage people to really embrace the importance of using those tools. This is all we have at the moment, and we are not going to have a vaccine this year, not in South Africa. We will have a vaccine next year, but not in January. It's going to take many months before we're able to procure vaccines, and even then they're going to have limited quantities to begin with. So we have to depend on and work out ways in which we encourage people to really embrace the importance of those measures.
And what is it going to take then, Prof, to get people to indeed go back to the wearing of masks, avoiding crowded gatherings, and doing everything else that we had started to do from when we started with this pandemic in March in South Africa?
Well, I think part of what it's going to take is exactly what you're doing, which is actually getting the media to really talk about it. But it's also about leadership, and we've seen the health minister go down recently and have many discussions with the leaders of health in the Eastern Cape, and deploying people to work down there and to see how we can look after the surge in patients as well as reinforce those measures. But I think that we're just going to have to work out, and we're going to probably get our social scientists to think, how do we encourage people, particularly young people who perhaps, finished a year of schooling, which has been really tough, or, just want a party at the end of the year. And they might say, well, it's not going to make me terribly sick. So we are going to have to really work out how do we do that. And things like social media, media coverage as you're doing, but reinforcing that message time and time and time again, and enforcing it. So if you have an event which is packed, which is what happened in the Eastern Cape, that in fact we do have to stop those events and prevent them from happening in the first place, but stop them if we see them with thousands of people gathered together.
And I want to stay with the Eastern Cape because at the moment it's the province with the highest number of active coronavirus infections, right? Now, as students return from, for example, from studying in Johannesburg, KZN and the other major centres, you're also going to see in the Eastern Cape the end of year is a time when a lot of families would then gather for traditional ceremonies. The Eastern Cape also has beaches where people gather for relaxation around the 25th and into the new year. Does government now need to look at a Eastern Cape-specific lockdown, perhaps? Because as things stand, it's already notorious for a health system that buckles under the slightest pressure, even without COVID-19.
Well, I'm sure government is looking at that, and if these numbers go up very steeply, that will have to be something to be considered. Do we have to do something more? But the most important thing, as I said, is we do actually have these measures, and they're recommended under the state of disaster. What we have to do is make sure they are implemented. I think one thing people don't necessarily appreciate is actually if you do wear a mask and you wear it properly over your nose, not here, and if you do wash your hands, and if you do stay carefully distanced from people, you're going to be protected and you're going to protect others. These things really, really work. And that's why we managed to, during the lockdown, we managed to keep the numbers down for a long time. So part of this is actually saying to people and enforcing those things that we need. But should the numbers go up higher, I'm sure the health minister and the command council are wondering what they should do, because there's so much movement between the Eastern Cape and the Western Cape in particular.
And part of the complacency, Prof, that I've heard from people are those who say, look, our recovery rate is still above the 90% threshold, so a majority of South Africans who have contracted the virus so far have indeed become better. So even if I do catch the virus, I will, looking at the stats, I'm most likely to recover, so I'll take my chances.
Well, you know, do that at your peril, because that's what a lot of European young people thought. And now we're seeing the numbers in Europe skyrocket. The same in New York, the same in Brazil. That there's a complacency that comes when you think, we've got this under control. And in all these places, we've seen the numbers shoot up. And we are seeing young people being hospitalized. And the impact of hospitalization is quite profound. It's not just because of the COVID patients. If you look at the Eastern Cape at the moment, surgery that needs to be done is being cancelled because beds are full. There's not enough oxygen. I mean, the impact of having a surge of patients means that health services are not going to be able to cope. So that sort of complacency that says, well, you know, it's not so bad, lots of people recover and they don't get terribly sick, I think be very careful. If you have a huge number of people, it does mean that a small percentage, if we say 20% get significant symptoms and 5% get really ill, that is an awful lot of people if you have thousands and thousands and thousands of people infected. So there is no room for complacency. We just have to look at the Northern Hemisphere to understand that.
Professor Helen Rees, always great to speak to you. Thank you, ma'am.